Mr. Roy, I just wanted to cover a couple things. I know a lot has been discussed about the nursing homes and what happened in my state of Pennsylvania as far as how it affected, while our population of nursing homes is relatively small, or assisted livings, and the deaths are relatively high. I take a look at that. We've discussed on that side of it, but how did the other 45 governors in the states that handled it better, were they looking at different information, or what do you think might have led them to make decisions that protected that population versus the governors like Pennsylvania, New Jersey, California that had the problem with the deaths in these facilities?
Well, I mean, I wouldn't want to necessarily at this point in time rank Pennsylvania's governor, 45th or 47th or 40th. I don't know if we can do that at this point, but I would say that in terms of the states, let's put it this way: the states that have done the best, and I'll use Florida as an example. What Florida did early on, their health secretary, Mary Mayhew, was very aggressive in resisting hospitals that were lobbying actively to have the permission to discharge COVID-infected patients, to offload them into nursing homes. And Mary Mayhew fought them on that very hard. It was not an easy decision to fight the hospitals, which are very powerful lobbies in every state, and say, no, you are not going to take those patients and get them out of your hospital and stick them in a nursing home as seeds, because then you're going to only get more patients in your hospital with COVID later. So she was aggressive about that, and she was also aggressive about limiting and restricting visitation rates, which of course is also heartbreaking, right? If you have a loved one in a nursing home, you want to go see them, you want to make sure they're okay, and that was a very difficult and painful decision that Florida did take early on that protected that population far better than other states did.
Okay, thank you. But one other thing I want to talk about, and it goes to my experience of having worked in a factory and later ran that larger manufacturing facility. And employers care about their employees, and they can actually keep them safe. We've looked through this whole pandemic and the shutdowns of larger operations, retailers, so on, being able to stay open, yet smaller businesses, which we know, our small businesses were more adversely impacted, whether it's minority businesses, but they were. So, is there any reason to believe that the small businesses can't practice the same guidelines, given the rules by CDC and so on, that the larger retailers were able to do during the time that the economy was shut?
Well, when it comes to, if you're referring to the fact that in certain states, large retailers were allowed to open, but small retailers were not, absolutely that was an asymmetry and a terrible policy, because those small businesses are the ones that help communities thrive, that help provide competition, that help provide lower costs to the consumer for all different reasons, let alone the employment piece. It's really important to have those small businesses competing with the larger businesses. So absolutely they have the capacity to, and we're seeing that in restaurants. For example, in Austin, again, where I live, Texas has allowed restaurants to open at up to a certain point. And every restaurant cares about not just its workers, but also its customers, to make sure that they have the confidence to patronize that restaurant, knowing that it's going to be safe, that they're doing what they can from a cleanliness point of view. So businesses have a powerful incentive to not only ensure that their employees are safe, but that their customers are safe. And that's far more powerful than any government mandate.
I agree with you on that, and I think that's part of the reason why we should look at some kind of liability protection for these businesses. That way people can make the decision on whether or not they feel safe patronizing a certain business, whether it be a restaurant or a retail operation. The other thing I guess I would look at, because we always talk about, I've heard it talked about any kind of resurgence of cases when we start to open our economy. And we always talk about the positive cases, and everybody's talking about how many more cases there are. But we're doing a lot more testing. Is there another metric that we can look at to make sure that we're understanding the spread of this disease? Maybe like the percentage of cases that are positive, so that we sort of understand and make decisions based upon good, rational information.
Well, Mr. Keller, I'm so glad you brought this up. This is such an important point. We're seeing a rise in cases, and that's in part driven by the rise in testing, right? If 5% of people test positive and you double the number of tests, you might have double the cases. But we're not seeing a corresponding spike in deaths. And that's because a lot of the people who are testing positive at this point in the pandemic are less medically vulnerable. Either they're relatively younger people, or they don't have as many pre-existing conditions like heart disease, high blood pressure, diabetes, etc. So for whatever, we don't yet know exactly, because we don't have that granular level of detail, but we do know that the death rate from the cases we're seeing now appears to be significantly lower, and that's not surprising, because in pandemics of all kinds, what you see is that the most vulnerable people die first, and then the virus starts to affect less vulnerable people who don't die at the same level of frequency.
Thank you, and I yield back.